The cargo plane carrying 300,000 doses of Sinopharm vaccine arrived at Wat Thai International Airport early on Monday at around 1 a.m. local time. Minister of Health Associate Professor Dr. Bunkong Sihavong gave an interview to local and Chinese media, saying this vaccine donation is of great importance. He thanks for the support from the Chinese government and people in Laos' anti-pandemic efforts. A shipment of China-donated COVID-19 vaccine doses arrived in the Laos capital city of Vientiane early on Monday. The cargo plane carrying doses of the Sinopharm vaccine arrived at Wat Thai International Airport at around 1 a.m. local time. Minister of Health Associate Professor Dr. Bunkong Sihavong and Chinese Ambassador to Laos Jiang Chai-tong received the vaccine shipment at the airport. It is recorded that the objective of the COVID-19 vaccinations are to A. reduce death and disease burden from the COVID-19 pandemic, B. reduce societal and economic disruption, and C. protect the continuing functioning of essential services. Vaccinations will be conducted progressively based on the vaccine supply availability. The vaccine supplied via the COVAX facility just arrived, thus mass vaccination could begin in April 2021.
ช่วยเหลือเทื่อนี้นี่มีความสำคัญหลายเนาะซึ่งว่าเราได้300,000 โดสมานี้และแม่นสิเฮ็ดให้พวกเราได้สามารถได้ซักให้บุคลากรการแพทย์
Speaking to reporters at the airport, Associate Professor Dr. Bunkong Sihavong, also Deputy Head of the National Task Force Committee for COVID-19 Prevention and Control, said this vaccine donation is of great importance. Once again, I would like to thank the Chinese side and thank the Chinese government and people for their selfless support to us. This is undoubtedly a timely aid to Laos in the fight against the epidemic.
2,000 โดสที่สักไปแล้วนั้นเห็นว่ามีความปลอดภัยดีและก็บ่มีอาการข้างเคียงอย่างหลายนะซึ่งว่ามันเป็นคือกันกับยาวัคซีนอื่นๆที่พวกเราสักอยู่
The Health Ministry has highly commented on the Chinese vaccine, believing that it's of a high quality and efficacy which will help protect Laos frontline health workers and public officers. Speaking on the occasion, Ambassador Jiang said that during China's battle against the pandemic, the Lao people have offered helping hands and China, in the meantime, has put Laos on the priority list of its vaccine aid plan. China remains committed to continue working with Laos to fight the pandemic amid the rising number of infections and deaths in many countries. The ambassador said, "We are pleased to continue cooperating with Laos through bilateral channels to ensure the safety of the lives and health of our two peoples." An official handover ceremony was held on Monday morning with the attendance of Vice President Pankam Vipavan. The Vice President expressed gratitude for the support from the Chinese government and people in China's anti-pandemic efforts. China is a participant in the COVAX program, a global initiative working for global equitable access to COVID-19 vaccines. The vaccine developed by Sinopharm China National Pharmaceutical Group Company Limited can reduce neutralizing antibodies in 99.52% of recipients and has a 79.34% efficacy rate. Several pharmaceutical research groups have already claimed success in developing a COVID-19 vaccine, and some countries are now carrying out vaccinations. Ambassador Jiang said in Chinese, which was transcribed later, said, "We acknowledge the urgent need for COVID-19 vaccines by the Laos side," adding that China is one of several countries that are in the process of developing COVID-19 vaccines. Ambassador Jiang recalled that Laos and China have offered mutual support and assistance in responding to the pandemic. Earlier this year, when Chinese cities were seriously hit by the COVID-19 outbreak, various groups in Laos provided equipment and cash amounting to $700,000 for China in its fight against the virus. Meanwhile, China sent 2 teams of medical experts to Laos shortly after Laos confirmed its first COVID-19 case on March 24th. China has also provided enormous in-kind assistance to help Laos combat the pandemic. According to the senior member of the National Task Force Committee for COVID-19 Prevention and Control, vaccinations are expected to begin in April, with 20% of the population likely to be immunized initially. At-risk groups, including frontline officials, will be given priority.